Hello, Anders. Welcome. I'm so happy to have you here with me.
Thank you, Nicola. I'm happy to be on your show.
I'll finally meet you.
Yeah.
It's the first time we meet, so glad.
Yeah.
I first heard about you a couple of years ago. I was starting to work with CO2, with slow breathing, as a way to bring me down, to get my health into better shape. And since then, I don't want to miss this way of life anymore because it's really become a way of life. So, my first question for you is you have decided to become a breathing expert. And as far as I understand, you had a good job and suddenly, or for some reasons, you changed and you said you wanted to dedicate your life to this way of breathing you're teaching. I think you even sold your house in order to do it. So,
Yeah.
why, of all the things in the world, did you choose breathing?
Because it changed my life. I had this typical racing mind, always in turbo mode. Not always, but most of the time. And I think I've spent the majority of my life making myself stressed out and people around me stressed out. Because if you are stressed, you will make other people stressed too. And when I read a book, How to Swap Asthma for Life was the title. How to get rid of your asthma by changing your breathing. I started to apply the techniques and tips there. And almost immediately, I was able to find that inner calmness, how slow breathing, nasal breathing, longer exhale helped me to relax. When people around me got similar effect, they were able to overcome their challenges. I was hooked, and then I decided this should be my new passion. I want to spread this across the globe.
So for you, it's all about being calm and maybe also being happy.
Yeah, I think that goes hand in hand. I mean, for me, I still love my turbo. It's not that I want to be without it, but the key is to be able to use different gears depending on what the task at hand is. But more than anything, I've seen that many people, including myself before, tend to be too much in stress and activity and fight flight, whatever the task is. And what they start to realize, as I realized, when they find the breath, start to using it as a tool to calm their nervous system, they're realizing then that they're able to achieve just as much or maybe even more in a state where they are more harmonious, more happier, calmer, less stressed because they slow down the breathing, so they move more into a state of parasympathetic. So when you slow down your breathing, one study showed, for example, that when you have low levels of carbon dioxide in your body, the adrenaline levels go up. When you slow down your breathing, you increase your tolerance for carbon dioxide. You will exhale less carbon dioxide. And typically, oxygen is activating and carbon dioxide is relaxing. So, that is what a lot of the teachings of conscious breathing is about. Slow down your breathing, balance your nervous system. It's fine to have your turbo and be in turbo mode and achieve and be stressed, etc. But it's great to also be able to find ways to relax and calm down. So use your breath as a tool to identify, where am I now? Am I in fight flight? You can easily do that by checking in on your breath, and then you can use your breath as a tool to calm down and get out of that state and realize that you will be able to achieve just as much, but in a state where you're slightly more happy and harmonious.
Yeah, I love that. But many people are saying, I love to do Wim Hof. I love to do the fast breathing. And they're saying, but CO2 is bad. What about that?
Yeah, I mean, no one can deny the fact that Wim Hof breathing or other type of forceful breathing has an effect. It's just to go on YouTube and watch the comments on a Wim Hof video where people say it has changed their life. So I'm not saying that that is bad, all these kind of forceful breathing exercises. I just think that this is more efficient. This is maybe not that reach the headline, slow down your breathing, compared to, okay, let's do some forceful breathing. It looks cool and you feel almost an immediate effect, while slowing down your breathing is more of a long-term approach, I would say.
Well, I have clients using the relaxator, that little device of yours,
Yeah,
and they often tell me, Nicola, it really works. When I'm getting excited, I just use it for a couple of minutes and I calm down immediately. So I
yeah.
wouldn't totally agree with that. The slow breathing doesn't have an immediate effect. I mean, people tell me.
I know that's very true. Actually, it's very true. But it doesn't look as cool, maybe. It looks a lot cooler when you're huffing and puffing. That we can agree on, right?
Yes, we can.
But actually, when it comes to slow breathing and what the relaxator does, as you just showed, it prolongs our exhale slightly. And inhale is tied to activation. If I'm exaggerating, while exhale, not that I'm saying we should breathe like that, but exhale is really tied to relaxation. So when you check the pulse, for example, on the inhale, the pulse goes up, and on the exhale, the pulse goes down. And there was one guy who contacted me some time ago. He's actually from Germany, outside of Hamburg, and he's a paramedic. And he said, I stumbled across breathing some time ago, and after noticing the huge benefits on myself, I started to apply it in the ambulance on my patients. And in 8 weeks, I have had 150 patients with a heart attack or a suspected heart attack. That's a fairly large number. And I have had 100% success rate, not a single failure. Normally, the clients that come into an ambulance, not only my ambulance, but in general, they come into the ambulance and they have a heart attack. They are in severe stress. And then they realize, oh, you're not even a doctor. You're just a nurse going to take me to the hospital. So let's get there quickly. I need a doctor now. And what often happens then is that they turn on the sirens and the lights, and that creates actually quite a large sound inside the ambulance. That makes the patient even more stressed out. So almost in every single case, they come to the hospital where the stress is higher than when they entered into the ambulance. So that's the normal. That's the normal, the reality for almost all patients with a heart attack across the world. But what he found when he told them to only prolong their exhale. Some of them could close their mouth and do it via the nose. Some of them could not, so they prolonged the exhale via the mouth. And with some of them, he needed to breathe with them. And he recorded everything, documented everything, the vital signs that they typically measure in the ambulance, the temperature, the blood pressure, etc. In every single case, just by doing this simple thing, prolonging the exhale, made all the 150 patients, when they arrived in the hospital, to be in a better state, less stressed, better vital parameters than when they entered into the ambulance.
So it's really easy to get calm and healthier by just breathing slower and prolonging the exhale. That would be an easy recipe for everybody to follow.
That would be an easy recipe for everybody. There is another study showing that it's a TED talk. Dr. Emma Seppele, she has done several studies. She has worked with war veterans. And when she talks about these studies in her TED talk, she says that these people are locked in a state of fight flight. They have developed PTSD. They come from war zones in Afghanistan and Iraq. And they try different modalities or medications and they just don't work. But breathing does. And the easiest way to calm the nervous system is to lengthen the exhale, is what she says. So those are two great examples of severe stress. One with PTSD because of experiences from war, and another having a heart attack. So if they can do it, it means that normal people living a normal life could also benefit from the same thing.
So, what does affect bad breathing? Or let me frame it differently. What does breathing affect in the body? For example, if you breathe with your mouth.
Yes, so mouth breathing typically creates irritated airways and lungs because the air taken in via the mouth, it's full of virus, bacteria, fungi, and other microbes in the air. Researchers tell us that we inhale up towards 100 billion particles in a single day. That's a huge amount. With mouth breathing, that goes unfiltered into the airways and lungs. And also, the air is cold and dry typically, which means the airways get irritated, inflamed, and then they will get swollen, and it will be harder for the air to pass in and out of the lungs, which means that mouth breathing effectively leads to fast, shallow breathing, which is the hallmark of stress, basically.
And there is much more to that. With James Nestor, you closed your nostrils in a clinical trial, I believe, for 2 weeks.
It was a trial, yeah. It was me and James. We did plug up our nose for 10 days, actually, 10 days.
And you
And we
experienced
measured,
many more effects, bad effects of that. I heard like it
yeah,
was something like a nightmare time.
it was. I mean, I'm glad I'd done it because the experience it was really great to get, but I would prefer not to do it again. We did a number of different tests. I think we tested ourselves 3 hours per day on average, and all kinds of things from blood markers, things in the blood like adrenaline. We measured our lung function, we measured our sleep, we were even recording the snoring, we were recording a video recording our sleep. You can see how we were twisting and turning. And I went from no snoring at all to 3 hours of snoring per night. And halfway through the 10 days, I think I started to say to myself, I don't even want to go to sleep. I know it's going to be a horrible experience. It was every single night. I woke up 5, 6 times every night. You could see the video how I was twisting, turning, fidgeting, and at some point, the adrenaline levels, for example, they were, I think, increasing threefolds at the end of these 10 days of mouth breathing. And I noticed that it was like I did a time journey back to my previous stressful life where I had more of stress, more of anxiety, more of adrenaline, and I started to crave more of the junk food and sugars. We did a lot of these self-assessment. How is your energy in the morning? How is your energy at midday and in the evening? One of them was, how is your sugar craving? So the first 2 days with mouth breathing only, I had no sugar craving. It was one from a scale from 1 to 10. And I had actually started measuring that a few days before the study started. So 4 days in a row, I had no sugar craving. And then it slowly increased. In the last 4 days, it was 7 to 8. That is quite high. So it was almost like all the thing that matters, the things I was thinking about was the next meal, the next way to reward myself. So the last 4 days, I had ice cream, chocolate, beers, pizza, and it was like, this is so important to me. Don't you dare take that pizza away from me. It's mine, kind of. Can you see what I?
Wow, yeah, that's
Yeah.
huge implications like stressed, hungry, bad sleep. I mean, that is a downward spiral if you continue.
Indeed, yeah. So it was so much more stress. So it seemed like I had to compensate with the poor sleep. My energy was running on the reserves, so the adrenaline was going up. So I had to compensate with quicker energy, fast energy.
So it seems like breathing right, breathing slow is the foundation for a healthy life, for serenity, maybe for happiness. What's your take on that?
I mean, in general, I would say I don't believe in happily ever after. That I find the magic pill and then everything was fantastic, or I met that person, or I did this or that. I think my analogy for that would be if you measure your heart and it's a flat, you are dead, right? The heart goes up and down. And I think that is what happens in our life as well. It goes up and down. But I would say that I am happier, I am more harmonious, I have more ability to reflect and see what patterns within me is contributing to this or that disaster that occurs in my life. So I would say that since I started with conscious breathing 15 years ago, my consciousness has increased, but it doesn't mean that I'm immune to stress or failures or doing stupid things or mistakes or being angry or saying things that I regret. All of that we don't want so much of, but I would say that I have less of that. I have more harmony in my life. So, yes, and I think at the end of the day, it boils down finding the balance between oxygen and carbon dioxide. Typically, when we are stressed, we have we take in too much oxygen. Our whole society is obsessed, completely obsessed with oxygen. And it is understandable because we really need oxygen for our survival. If we stop breathing, we die within minutes because we need oxygen so badly to produce energy. What we seem to have failed to forget is that oxygen is toxic. One reason why we store so little oxygen in our body, well, one reason is obviously that it's abundant in the atmosphere. We have about 21% oxygen, so it's easily accessible. Another reason why we store so little in our body is probably because of its toxicities. Oxygen is really both a curse and a blessing. We can't live without it, so we need it. But if I take a bite in an apple and put it down, that apple will start to turn brown after some time. And that's because it's exposed to oxygen. And same, that's why we protect food from oxygen, right? We put plastic around it and put it in the freezer.
And we put CO2 into that plastic if we are making industrialized foods.
Yes, that's true. We can put CO2. So that's been used in the food packaging industry since the 1930s. That knowledge that oxygen makes the food decaying, not red meat, for example. You want oxygen there because the meat to stay red. Otherwise, it will have more of a gray look. But carbon dioxide is used to pack a lot of foods, actually, because of its antibacterial effect. But so anyway, that process that goes on, that biological process in the apple that makes it turns brown, and that we want to prevent. So the apple has peel, the banana has a peel to protect it from oxygen and that oxidative damage. But the same processes also happens in our body. So if we have too much oxygen, we will increase the formation of free radicals, the free oxygen radicals, which will then increase the oxidative stress in our body. And the free radicals lays the foundation for inflammations. And it's not that inflammations are bad. The problem is if we have too much inflammations and across the line, almost whatever disease we are talking about or symptoms, we have a heightened levels of inflammations. And typically these health issues, they go hand in hand with faster breathing where we have too much oxygen. So that's the one side of the coin. And the other is too little carbon dioxide in our body, because the faster breathing will also make us exhale more carbon dioxide that is produced in our body. So the levels will be lowered. And carbon dioxide is a lot more than just the simple waste product we think it is. First, it controls breathing. I mean, that's our most important bodily function. And that is controlled by carbon dioxide. It is not lack of oxygen that makes us take the next breath, which we may think. It's actually the build-up of carbon dioxide. So if we have low tolerance for carbon dioxide, that translates to faster breathing. If we have high tolerance for carbon dioxide, it translates to a low and slow breathing, which the first one is the hallmark of stress and an anxiety, while the second one is the hallmark of relaxation and harmony. If we think about it, what is the main difference between a person in a complete state of stress, like a panic attack, and then on the other hand, a person that is in complete relaxation and harmony? I would say that it is not sleep, it is not exercise, it is not food, it is breathing. the person in a state of stress is breathing fast and shallow and big or holding the breath, while the person in relaxation is breathing low, slow, rhythmically. And we know that if we have a panic attack and come to the hospital, or if we are afraid of flying, the nurse at the hospital or the flight attendant will give us a bag to breathe in and out through. Yeah. And why does bag breathing works? Because it will restrict the oxygen you take in, because the oxygen in the bag will start to go down, right? And at the same time, we will inhale some of the carbon dioxide we just exhaled. And we exhale about 100 times more than we inhale. So that means bag breathing restrict the oxygen intake and increase the carbon dioxide in our body. And then the stressed brain can start to relax. And we talked about one of the things that carbon dioxide does to control breathing. Another thing is that it makes the smooth muscles relax, and they are surrounding the airways and the blood vessels. So CO2 is called a vasodilator. It helps the blood vessels open up by relaxing these smooth muscles. So the stressed panic brain in a panic attack is starved of carbon dioxide, which makes the blood vessels constrict so that the brain is then starved of blood and oxygen. So when we restore that balance between oxygen and carbon dioxide in our body, blood vessels will open up and the stressed brain will start to relax.
That's so interesting. But it might be the fountain of life. It might be the foundation of life. Why is that?
Well, we are carbon-based creatures, right? And if you look at the life forms that exist on this planet, most, I would say, complex life forms, they require oxygen. But actually, not all life forms require oxygen. So, however, carbon dioxide is required by every single life form on this planet. Carbon dioxide is, in a way, the foundation. When life arose on the planet, none of us was there, so we are just guessing, of course. But the dominant scientific theory is that there was no oxygen in the atmosphere. However, the level of carbon dioxide was about 5%, which is the amount we should have in a healthy cell.
Under CO2 is seen as bad and as a waste product. Is that true?
No, far from it. I would say that would be as far from the truth as you could possibly come. So oxygen, we know how key it is for us. We need oxygen to survive, to produce energy efficiently. And it turns out that it is carbon dioxide that lays the foundation for efficient oxygenation. In every single step, carbon dioxide is involved in oxygenating the body, all the way from taking in the oxygen from the atmospheric air, get it to travel all the way to the mitochondria in the cells where the energy is produced. So first, carbon dioxide stimulates breathing, makes us inhale the oxygen. Secondly, carbon dioxide ensures that the smooth muscles in the airways, they are relaxed so that the airways stay open. Thirdly, the same happens in the blood vessels where carbon dioxide ensures that the smooth muscles surrounding the blood vessels are open so that the blood can flow easily. And fourth step of body oxygenation is to kick off the blood from the hemoglobin. From the hemoglobin. And carbon dioxide plays a crucial role in making the hemoglobin change shape from holding on tight to oxygen to releasing the oxygen. That is called the Bohr effect. And that happens when there is a cell that is in need for oxygen. For example, if I move this arm muscle, it will require more oxygen. And when I move the muscle, carbon dioxide is produced in the muscle, it leaves the muscle, enters the blood, and forces the hemoglobin to release the oxygen so that the oxygen goes in the opposite direction from the blood to the muscle so that the muscle can continue to work. And the fifth step is then when the oxygen has reached the mitochondria in the cell, It is to ensure a safe production of energy. So, as we talked about, oxygen is extremely reactive. And if this process of creating energy in the mitochondria with the help of oxygen is not controlled, the mitochondria will be damaged. The mitochondria is the main site for leaking free radicals. And that happens either if we have too little oxygen or if we have too much. And carbon dioxide is the way to ensure that this process doesn't go out of hand. So you can see oxygen and carbon dioxide as yin and yang. They work in tandem. And if the levels of carbon dioxide is lower, there will be more free radicals produced in the mitochondria, creating more inflammations. So several studies have shown how carbon dioxide is an antioxidant, a powerful antioxidant preventing the damage of the mitochondria. So these are the 5 steps of efficient oxygenation and efficient energy production, where carbon dioxide is involved in every single step.
Wow, that means without carbon dioxide in the body, we would die.
Yes.
People love inhaling oxygen. In German, it's called IHHT. So it's restricting the intake of oxygen and then giving more. As far as I understand, it's not the best way to getting more oxygen into your cells. Do you have a short explanation on why?
HT, I have only tried it once. I liked the experience. So first, my oxygen was restricted and then it was increased. During a 40-minute session, I went down to 8% and I went up to, I think, 35%. So it was challenging my body, forcing my body to adapt to lower levels and higher levels. And again, I think that is a therapy that's out there. I just think that carbon dioxide therapy is more efficient. Helping us tolerate higher levels of CO2 will help us to stay calm when we're under stress and pressure, and it will reduce friction and restriction and resistance and instead open up our body to restore a free flow of air and blood. And that is the main problem, I think, when we have different kind of issues. There is dis-ease. There is not an ease of flow. There is a dis-ease. So if I have an area in my elbow or in my hip where there is less flow of blood, there will be less oxygenation, there will be less removing of waste products. That will then lead to problems. So we want to restore that flow, and carbon dioxide is the number one player in restoring that flow. So I'm not ruling out any therapies out there. I think many of them are fantastic. The only thing I'm saying, I just think that the CO2 therapy is more efficient.
So CO2 opens the blood vessels. So there's more better blood flow in the body. It helps to get the oxygen into the cells, or it's the main player in getting the oxygen into the cells, and it prevents the oxygen to act as too much of a free radical. That means it must make the body so much healthier. Even I'm guessing it might help people to get rid of the pain on top of calming you down, feeling more balanced and harmonic. Do you have
Yes, because
experiences with people that told you about these things?
yes, very much so. And also studies show it's not only the smooth muscles that relax, it's also the skeletal muscle that we can control by will. And typically when we experience pain, we have tensions, right? We have tensions in our mind, and we are emotionally tense, and we also have muscle tensions. So actually one effect of painkillers is that they reduce the breathing.
Wow.
And when we reduce breathing, we increase the levels of carbon dioxide. A fascinating book which I republished on Amazon. It came out 1794. That's a long time ago. Written by an English doctor, and the title is how he treated 2 cases of breast cancer, ulcerated breast cancer, meaning open wounds. And one thing he writes in the book is that in every single case when we applied carbon dioxide to these open wounds, the pain diminished or went away. One woman, she had such a big wound, open wound, it was like 15 centimeters times 8 centimeters, huge. She could scream for up to 2 hours per day just because of that wound. And after a month of applying CO2 to the breast, the wound had reduced to less than a third. And they say that in every single case when we applied CO2, the pain went away. And then when we stopped applying CO2, the pain started slowly to come back. One doctor, I think it was somewhere in the 1800s, he just did a simple test. He created a blister. He removed some of his skin from the finger, and then he exposed it to 100% oxygen, and it hurt like hell. And then he put it in 100% carbon dioxide, and the pain completely disappeared.
That's amazing. And that's what my
Yeah.
clients tell me. Some with severe pain, they get into CO2 bath into the body stream and the pain is relieved a lot and even for hours after that. Okay,
Yeah.
so time is up. Thank you so much. And I hope to see you again.
Thank you, Nicola. It's been a
It's
pleasure.
been a pleasure.